the towel over your top half? Are you cold or what?
I'm okay.
Okay, so we're going to move on to some stretches and range of motion tests now. So I'm just going to obviously check both sides to make sure I can determine if there's any imbalances in range of motion. So we're going to start off with the hamstrings. So I'm just going to get you to lift your leg up yourself as much as possible before we get to a point of failure. That's it, keep that leg a bit more straight, that's good. Okay, so what I'm going to do is I'm just going to assist the stretch now, but we're going to work up to about an 8 out of 10, so let me know when that is, yeah?
Yeah.
We're about there, okay. Just going to hold it for a few seconds. Okay. So we bring your right leg up now for the same. Okay. And then again, let me know when we get to about an 8 out of 10.
Yeah.
So I can see with this, with the hamstrings, for example, that the left side was a lot less range of motion. So left side would indicate that the left side is a lot tighter than the right side. Okay, so we are just going to check your adduction. So that's the inner part of your thigh. So what I want you to do is keep your legs straight and then bring your leg out towards me, okay? That's it. So we're going to do it to a point before we sort of rotate the leg. So we're going to try to keep it nice and upright. So we're about there, yeah? We just bring this hand up towards just here, so it's out of the way. Okay. So what I'm going to do now is the same again. I'm going to assist the stretch. So I'm just going to support you by placing my hand on the hip, and I'm going to pull the leg towards me. Let me know when we get to about an 8 out of 10.
Yeah.
Okay, we're there. So we'll do the other side. So bring the leg to me, keep it down a little bit. Yeah. And then we're just going to rotate so the knees up, facing upright, that's it. Okay, same again. Let me know when we get to about an 8 out of 10.
Yeah.
Okay. So adductors, fairly even on that, fairly equal range of motion. So we're going to do abduction now, which is the sort of outer part of the glute. So what I want you to do is bring this leg underneath, right? So we're going to do this side again. So you're essentially going to be bringing your foot towards me. Okay. Same again, I'm just going to brace the hip and then assist the stretch. Let me know when we're about an 8 out of 10.
Yeah.
Okay. Right, so let's do the other side now. Okay. So bring the foot towards me. Okay.
Yeah.
We're there. Okay. So again, right side had more range of motion. Left side was definitely a little bit tighter. Okay, so we're going to do your hip flexors now. Okay, so what I want you to do is bring your knee up into your chest. How does that feel?
Yeah.
Okay, so what I'm going to do is I'm going to assist the stretch now, so you can put your hands down. Okay.
Yeah.
Where are you feeling that in particular?
In my hip flex.
Yeah, okay.
Yeah.
See, I didn't put much pressure into that stretch at all, so the hip flexors are clearly very tight. Let's do the other side now. So just bring it up without you touching it first, yeah? Okay. Okay, let me know when we get there.
Yeah.
Okay. So I could notice that the bum was coming off the table a little bit. That would probably indicate that it's trying to make it easier to kind of get the range of motion because it's tight and painful for the client. So what we do is roll over onto your front. We're just going to finish off with your quadriceps, and then we're going to check your dorsiflexion as well. Okay. So I just want you to bring your heel into the glute. Okay. So I'm just going to assist by pushing down on the foot. We should feel this in the quadriceps now. Let me know when we're getting out about 8 out of 10.
Yeah.
You there, yeah?
Yeah.
So heel's not actually fully in contact to the glute, so it's quite tight. You can feel a bit of resistance on pushing as well. So let's do your left side now. Again, let me know.
Yeah.
Okay, so yeah, definitely less range, probably about another centimetre off the glute with this, and I can feel even more resistance in the left quad. Okay. So, I'm just going to bring this up, and I'm going to essentially push down on the foot just to check the dorsiflexion, see how if I can feel a lot of resistance in the sort of calf and around the ankle area. So perhaps let it go nice and loose. How does that feel?
Yeah. That feels okay.
No pain?
No.
Okay. That's still okay?
Yeah.
So yeah, I can feel a lot of resistance and very limited on that dorsiflexion. We're not really even getting beyond the sort of 90-degree angle. So if we bring this leg up just to finish off. How does that feel?
Yeah. Fine.
So we've got a bit more movement in the right side for the dorsiflexion. We're getting just beyond the sort of 90-degree angle, so would indicate that the calf on this side is a bit tighter, just restricting the dorsiflexion a little bit more.